Good afternoon, everyone. Welcome to COVID-19 webinar series. My name is Yasmina Sisterak, and as always, I'm your host for today's webinar. Thank you for joining us today. COVID-19 webinar series are presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council and collaboration with Aspire Community Services in Illinois. For today's presentation, our second to last webinar of the series, Employment Resilience, People with Intellectual and Developmental Disabilities are Critical Frontline Workers. We are delighted to have Erin Riley, who is the founder and senior director of Project Search. Erin Riley is a recognized authority and national leader in promoting employment opportunities for people with disabilities and other barriers to employment. She's a senior clinical director of disability services at Cincinnati Children's Hospital Medical Center. Erin is a co-founder and director of Project Search, an employment preparation and transition program that has received national and international recognition for innovative practices. For today, internationally, some COVID-19 policies meant to protect people with intellectual and developmental disabilities could have the negative effect of restricting people with IDD from working due to health concerns solely based on disability status in the absence of any evidence supporting this practice. This presentation will explore these policies and discuss Project Search graduates who are part of the solution on the front lines of the COVID-19 pandemic. The impact of people with intellectual and developmental disabilities working on the front lines will be discussed along with policy implications. Again, these webinars are recorded. We will archive them and make PowerPoints and all the resources available. Please ask any questions that you have in the text box or a question and answer box. We will have about 15 minutes at the end of the presentation to answer these questions. And thank you again for joining us. Erin?
Hey, thanks, Yasmina. I totally appreciate it. I'm looking forward to being with all of you on this second to last presentation. So as Yasmina said, my name is Erin Riley, and I'm the director and founder of Project Search. And I'm going to talk to you today about employment resilience, people with intellectual and developmental disabilities as critical frontline workers. You know, you can't open a paper, or look online is probably the more appropriate thing to say, but you can't look at the news or on Facebook, you can't look anywhere really without seeing some glaring headline that says, disability advocates call for protection of the most vulnerable during COVID-19 pandemic, and pandemic heightens vulnerabilities of persons with disabilities, or people with intellectual disabilities are being hit hard. COVID-19 infections and deaths are higher among those with intellectual disabilities. I could go on and on and on. It just seems that in most stories, that the topics that are put together are people with disabilities and vulnerability. And quite honestly, it seems really scary. And if you were a person with a disability and you were considering employment or even going out into the community, it would be a really scary time. And there are really valid reasons for the increased vulnerability. And I think that's the important piece, to talk about the reasons for the increased vulnerability and then to look for the information about those things. So those reasons, again, incredibly valid, are that if you're a person with a disability during COVID-19, chances are you're struggling with food insecurity. You may be lacking money to buy food, you lack access to food, transportation, many reasons that you might be facing greater food insecurity. Maybe the people who are working with you or supporting you are less present in your life. There's also increased lack of access to healthcare and testing. You know, if you are at home and you're afraid to go out because you believe it's going to increase your vulnerability, then chances are you're not going to go to your physician and you're going to suffer from that lack of health care. There's also inadequate safety education. Here at Children's, we talk every day about safety education, and we work to educate all of our staff. But again, if you're at home and you're not working or you're not getting out into the community, what you're mostly hearing are those headlines that talk about how vulnerable you are and how high the risk is. And then there's social isolation. Probably one of the greatest reasons for increased vulnerability is just the isolation that comes from being at home and staying at home and not hearing or seeing what's going on in the rest of the world. And then finally, there is certainly the increased vulnerability that comes from underlying medical conditions. And I think, and again, this is all really understandable, and that's the important thing to remember. There is an impulse to protect and shelter, and sometimes an impulse to panic. It's kind of that fight or flight mechanism that we all have when we don't know what's going on or what we should be doing. We resort to that impulse to protect and shelter, or to fly from the situation. But in this case, panic is neither warranted nor helpful. And in fact, withdrawal from employment can actually increase social isolation. So what I'm going to talk about today is the fact that none of us should disregard the risk, but instead we should come up with practical solutions to minimize the risk. And I'm going to talk about some of the policies that are out there, some of the definitions of risk, and then some of the things we're doing in Project Search to assist people in minimizing the risk. So the CDC guidance on COVID-19 and disability says, and this is really important, that most people with disabilities are not inherently at higher risk for becoming infected with or having a severe illness from COVID-19. All people are at higher risk of severe illness from COVID-19 if they have serious underlying chronic medical conditions like chronic lung disease, a serious heart condition, or a weakened immune system. So in other words, it is not the disability per se that increases the vulnerability. What increases vulnerability really is an underlying chronic medical condition. And all people who have underlying chronic medical conditions are at higher risk, not just people with significant disabilities. So I'm just going to say one more time, having a disability is not in and of itself a risk factor for having severe illness from COVID-19. It is related to whether or not you also have a chronic medical condition. And then here's the second part of that that's equally important. The Equal Employment Opportunity Commission says that an employee's medical condition is not considered a direct threat to themselves if the employer can reduce or eliminate the threat through a reasonable accommodation. And I'm reminded of our situation here at Cincinnati Children's. We have about 60 employees with significant disabilities who work here. And it's absolutely true that we had several folks with disabilities who felt like they did not want to come to work because they were more vulnerable as a person with a disability. But in fact, most of them said and continue to say, in support of this statement by the Equal Employment Opportunity Commission, that the hospital is probably one of the safest places you could be. It's far safer than being stuck at home, not eating well, not getting the calories you need or the medical care you need. If you're in a hospital, we are reducing or eliminating the threat as much as possible through reasonable accommodations. And we are able to teach all of our employees how to properly mask and gown and glove and wear eye protection. We're giving folks masks and hand sanitation. And so if you're working and your employer is concerned in following policy, then actually even a medical condition is not considered a direct threat. So here's what we believe in Project Search. We believe that employment is actually a key factor in decreasing vulnerability. The increased income helps reduce food insecurity. Employment increases the likelihood of access to health insurance, and it increases the likelihood of being around people who can assist you to get what you need from healthcare, can transport you to physicians or to your clinic appointments, make sure that you're not missing dental appointments or simply missing services you should be getting. Employers provide safety, education, and equipment. Many hospitals, retirement communities, grocery stores, they were all provided with safety, education, and equipment to pass on to their employees. But you can only get that if you're an employee, if you're employed. Community engagement and inclusion is certainly increased through employment. Here at Project Search, we believe that sometimes community engagement is one of the things that's most harmful in general for people with disabilities. It certainly is harmful for your mental health, and mental health or poor mental health is a key factor in increasing vulnerability. And then finally, medical vulnerabilities can be accommodated in the workplace. And that's, again, what we're seeing at Children's. If you do have a vulnerability, we can take extra steps. We can make sure we get you a better mask or a better face shield. We can switch the location of your work if need be and if possible. So there are many accommodations that can be put in place in the workplace, which ultimately may keep you more active and less vulnerable. So most of you, or many of you, know Project Search is a transition to work program. And in general, during this time, we are not retreating from our goal of employment for people with disabilities. We think it's a slippery slope, to be honest. I know that in England, they came out with a government policy that described all people with disabilities as being a part of a vulnerable population. And in Project Search, and you may disagree with this, and I'd be really interested in hearing feedback, but in Project Search, we're quite worried about that because, people with disabilities and their allies and support workers have worked so hard for so long to say, listen, we are worthy of employment. We are capable of employment. We can be some of your best employees. There's been this, this hidden ceiling which has kept us from being employed. And now it feels that just as we're kind of getting that message out there, we're seeing these policies by an entire country that are saying, well, people with disabilities are all vulnerable. And I think if we take that to heart, we pay attention to it, and we say, we're all vulnerable, we shouldn't be put at any risk. I think that's a huge step back for employment. It basically reinforces some of those stereotypes and beliefs about people with disabilities from the olden days that we want so badly to leave behind. So we are not retreating from our goal of employment for people with disabilities. What we are doing, we are taking the steps necessary to mitigate the associated risk and make employment as safe as possible, not only for people with disabilities, but for any person. So several of the things we're doing, and I'd be happy to share this information, Yasmina. If anyone wants to see some of these tools, we're happy to put them out there. One of the things that we did in working with community rehabs and rehab providers in schools is that we encouraged them to come up with a continuity of operations plan. And the truth is, you could do this with your family too. You know, in the federal lingo, it's called a COOP plan, CO of continuity and OP of operations plan. But the continuity of operations plan is basically a way to take what the facts are and create a response and prevention plan that allows you to constantly evolve. So, for example, you would take the situation and you'd write out what your options are. You'd list pros and cons, and then you would choose which of those solutions. So we recommend that our program sites and our community rehab providers create a continuity of operation plan to address scenarios and offer a variety of possible solutions. And here's what that looks like. It doesn't need to be overwhelmingly difficult. It can be pretty, easy. Simple is what I was going to say. You can, put a grid on a sheet of paper, and you're going to list out scenario one. So maybe scenario one is that the host business is available to interns, but the classroom is too small to accommodate social distancing. And then you're going to come up with a number of options. And I couldn't put them all on this page, but I see that what I see is that what I know is we have 4 options here. And then we list the pros and the cons and the comments. And we propose a solution based on what we're going to do. And so that's the continuity of operations plan. And we would recommend that individuals, businesses, CRPs, and schools all do one to deal with all the scenarios that you might face over time. It's funny, I just saw someone that wrote and said that they're finding that businesses are more resistant to hiring. And that's actually just the opposite of what we're finding. What we're finding is that there are certain businesses who are desperate to hire, and there are some businesses who are scared, and they tend to be smaller. But just for example, any business right now, and I didn't put this in the talk, so I'll just take a few minutes to do it. Oh, it is later. You know what? Sorry about that. I hope you don't give me a bad evaluation for that. I'll talk about this in a minute. Why we're seeing. I shouldn't have read the question, Yasmina. Sorry about that. So we also recommend that you use a tool to assess skill competencies. There are lots of tools out there. One that we use that's free to use, that's widely available to folks who are interested is called VoteFit.com. It's an online tool. It can be used remotely. A person with a disability, their parent, community rehab provider, job developer, job coach, VRR counselor, anyone can use that and fill that out. It's very evidence-based, and it can incorporate feedback from multiple stakeholders. What it allows us to do is identify individual training needs, and then to find out which of those training needs we can most easily teach at home. So right now, if you have folks who are at home and can't get out and they're part of a training program, how can you identify and focus on skills that can be most easily learned at home? And then it allows you to do virtual skill competencies. So what we are doing is we are shifting our focus to teaching those skills competencies at home when we have to. And we know many transition programs are doing the same. And when you need to teach things at home, and it is necessary for some programs, there are a couple things you need to do and that we've done as a result. First of all, we all need to shift our focus from rewarding effort to measuring quality and productivity. Often in school, for every student, not just students with disabilities, we tend to reward effort in school. That's what they're about. That's the whole purpose, and it's a really good thing in school. But then when you become an adult and you begin to work, they cease rewarding effort. They don't really care how hard you tried. They care about how well you did and did you finish. So there's that huge shift in adulthood to measuring quality and productivity. So keeping that in mind, we have created 20 lessons that allow us to teach skill building using home activities and shifting that focus from rewarding effort to quality and productivity. Those lessons were built on categories that we found from our VoteFit tool. So even if you're not using the VoteFit tool, use some kind of assessment, look at your categories, pay attention to where folks have what skills they need, and then match up the skills that you can teach at home with the most needed categories and create your own curriculum. So on the VoteFit tool, these are the main categories, and I have 3 slides. One of the categories looks at cognitive ability. That's a pretty usual, normal category on any of these assessments. And some of the things we might teach are how to count, weigh, measure, or organize materials, and how to comprehend or read instructions. And so you can look at that assessment, that tool, and then you can create a lesson at home that takes into account what you need in order to increase work skills. So communication skills is another frequent category. The 2 of the things might be communicating with others on the telephone or speaking clearly so that others can understand. Definitely things that can be taught at home. Computer skills. How do you access an email system using a username and password? How do you print a file and document? General category in the VoteFit is items such as accepting constructive feedback and following rules. Again, things that can be taught at home and added to your curriculum. And then there's higher task-related activities. And these are things that, when we say higher, on the VoteFit tool, it simply means that have more parts or more pieces. And so performing clerical duties, selecting materials needed to complete the work task. Interpersonal skills include things like asking clarifying questions, cooperating with others to accomplish work activities. Lower task-related activities might be stopping and starting machines, using a lever or button, or cleaning work tools. And even though you're not at work, or you may not be at work, or you're still learning so that you can get employed, there are lots of things that you can practice at home that practice and teach these same skills. Even starting a coffee machine, or stopping the oven, or if you're gardening, taking care of your work shears teaches you to clean those work tools. So it's adding these steps that you see on assessments, especially in areas where you know there's deficit or a need for increased learning. That's so important. Another category is physical abilities. Can the young person or the adult perform physical activities repetitively? Can they work for a prolonged period without a break? And this is something that you need to work on at home. We need to increase the stamina of folks with disabilities. Stamina is not something you're born with. Stamina is something that must be developed. And competitive employment requires stamina. So at home, as you're getting ready for that job, or getting ready to go back to your job or get a new job, it's not enough to just work on something once. It's about doing repetitive work and working for a prolonged period without a break. Really important. Safety is another common field on assessments. And things like maintaining sanitation, health and safety standards, wearing common protective and safety equipment. So it's teaching mask wearing even while they may not be employed. It's teaching hand washing, frequent hand washing, how to wash and sing the ABC song, how to properly wear a mask so that it's on your nose, covering your nose and your mouth. And then the last 2 categories that you can use for skill building at home are self-determination. Teaching our people with disabilities to make choices, decisions, and plans to meet their own goals. So creating a schedule and sticking to it, getting up at a certain time, setting an alarm to go to bed at a certain time, and then evaluating the results of your own actions to determine effectiveness, always building in that evaluation for quality. And then the last category we've included, or I've included today, is work structure. And so teaching folks to pace their work according to the demands of the work. And this is probably one of the most important, to follow established procedures and not to do it just the way they want to do it or have done it in the past. And so those are some examples of categories that came from that VoteFit tool. It's probably less important that you use these categories than it is that you use some categories that match employment and figure out how then to build skills at home. You want it to be as objective as it possibly can be. So here is a great example. And this may not seem, you're probably saying, well, that's not rocket science. Well, it's not. Much of this isn't. It's about doing it. And so one example you might give to a young person with a disability is to be responsible for a virtual game night for the family. And looking at the VoteFit tool and the categories, a communication skill might be to speak clearly so that others can understand the speech of the person who's giving direction. The self-determination goal might be making choices or decisions or plans to meet the goal, setting the night up, letting people know, determining a start and an end time, deciding who goes first. It's making those decisions independently. That's really key. And it's setting personal goals that satisfy your own interests and needs, determining work activities, determining the customer needs. How many people are going to play the game? And are you going to use a table and chairs? How do you set them up? Where do you get them from? Which game are you going to play? So there's so many decisions that need to be made, and it's all related to that communication. And then in general, under the general category, it's completing the task accurately. So, if you have to have the board set up, you have to have the pieces laid out, and you're playing Monopoly. How do you have to have the all the parts of the game? How do you ensure that they're set up accurately, and so that you don't someone else doesn't jump in to complete it, but you stand by and you give necessary direction, and then you also ensure that the young person takes the direction. You might be playing a game on the computer, and if you are, then you want the person with disability to navigate to a specific web address and to click on that desired web link. You don't want to do it for them because it may be difficult. On interpersonal skills, you certainly want folks to work with a coworker in a group or team and follow directions. If there are rules to the game, then we should be following those directions and not making up different directions. We want the person with a disability to ask the clarifying question and to listen actively, and not to ask unrelated questions as you're playing. And then under that category of higher task-related abilities, allow the person with a disability to select the materials needed to complete the game. Do we need paper and pencil for scoring? Are we missing a piece? Is everything here? Do we need to get folks drinks and snacks while they're playing the game? What are we going to do during virtual game night? So you can take almost anything and turn it into a skill building exercise at home. And the skill building, and I've said this before, I'll repeat it, skill building can be really important if the person you're working with is furloughed and not working temporarily, or it can be important for a person who's not working but is looking for a job and unable to go into the CRP or to the to a day program where they're actively working on these things. So it's a way to actively build skills even during COVID-19. Another thing we're encouraging is partnering with occupational therapists. There are so many occupational therapists out there, and there are also a lot of occupational therapy students. So, to actually practice as an occupational therapist and have your OTD, it's a 3-year process. And in the first year, I believe you have to have 40 hours as an intern, and then it goes up from there. And in that 3rd year, it's well over 200 hours as an intern that occupational therapists have to have. And right now, with COVID, they are struggling to find internship opportunities. So if you're a school or you're a community rehab provider and you have the ability to take an intern, reach out to these schools, partner with an occupational therapist, and then include them in teaching people with disabilities in the home setting, either virtually or in person. They are great at creating accommodations and adaptations. So link up with them so that you gain expertise yourself, or your agency gains expertise in accommodations and adaptations. And then you might even look to establish a virtual consult service for individuals with disabilities and their families. Maybe you bring an OT into the office and they link up virtually with your individuals who are at home and talk about what skills they're doing or where they're struggling, and create this virtual consult so that you can actively create those accommodations and adaptations. One of the things that we have done, and probably many of you have done, but it's necessary if you haven't, and we'd be happy to assist, and that is to create COVID-19 lesson plans that you can push out to the community, to families, to your employees with disabilities, to anyone with a disability. And the 5 lesson plans we created with an occupational therapist are on cleaning and disinfecting materials, COVID and personal protective equipment, hand washing, coughing and sneezing, mental health, and social distancing. And all these lesson plans can be used virtually. Now, I want to talk about this a teeny bit, and just to say that here at Children's, I mentioned before, we have nearly 60 employees on site who have significant disabilities. And what we're finding is that the area in which they are having the most difficulty isn't masking, it isn't hand washing, it's not even cleaning and disinfecting materials. It's actually in social distancing. So we've really had to work to make social distancing understandable and to constantly reinforce that need to maintain proper social distancing. All right, next slide. Another thing we're working on and we encourage is parent education. And hopefully there's some parents who are on this talk, but a big part of it is recognizing and honoring the parent throughout this COVID time. And it's really important to recognize that all of us have that impulse to protect and shelter our kids. It is totally normal. And certainly parents of people with disabilities have that same impulse to protect and shelter. And part of education is to help the parents also consider and evaluate all the risk and to understand the balance of risk and the benefits of work. So it's helped them to move beyond that just simple risk assessment into how do we balance that out? What is gained from work? And so we don't want to minimize that risk and we don't want to disregard it. Instead, we want to help our families come up with practical solutions that minimize the risk whenever is possible. So some of the things, and this is what I started talking about before in my excitement to get to this, is that what we are seeing, and we have over 600 programs around the world in all types of businesses, hospitals, hospitals, retail, grocery stores, distribution centers, colleges, hotel, motels, factories, military bases, even museums. We have lots of programs in lots of different settings. What we have seen is that some of those settings are really struggling with training, employment, and training and employment opportunities. Others are really right now looking for essential workers. And so I want to talk about how to identify the difference and where you should look for employment right now, according to what we're seeing. So the key really is who right now has decreased capacity but increased regulation. So decreased capacity combined with increased regulation. It's a mouthful. A perfect example are restaurants. So restaurants right now are being told that they can serve oftentimes less than half their normal capacity. So already they're going to be hurt financially because they have decreased capacity. But the second thing they're facing is that during this time of decreased capacity, they actually also have increased regulation. So they're making less money, but they have to follow more rules and have more people to implement those regulations. So the perfect example in restaurants and retail is that you have reduced seating or reduced number of customers in the store at the same time that you have new disinfection protocols being required. And as a result of both of those things, income is reduced. And so it's a really good time. We are seeing an interest on behalf of restaurants and retail to hire or train people with disabilities because it assists with both of these items. Grocery stores and distribution centers, same thing. Right now, they are struggling to maintain inventory. Things are coming in and going out as quickly as they get them, and they need help with materials handling, and at the same time, they're facing new disinfection protocols. And grocery stores and distribution centers in general are hiring, and we're seeing that they are willing and excited about hiring people with disabilities. Hospitals and retirement communities, same exact thing. They're faced right now with needing to do surface sterilization in areas that were never sterilized on as frequent a basis. They certainly were cleaned well, but surface sterilization is now required at a much higher level than it ever had been. And then they're requiring screening of all incoming patients, guests, and employees. So our hospital now has essential functions, essential jobs that are open. And the truth is, some of these jobs may be in cleaning, and maybe that's not the preferred job the person is looking for. I think what we're saying is that for these restaurants and these grocery stores and hospitals and retirement communities, just to get your foot in the door at some of these places is a major coup. It's incredibly positive. And get your foot in the door, show that you can be an essential worker, take this job, use the opportunity to learn as much as you can, and then once you're in the system, look for that opportunity to get the job that you really want. I can tell you I've been a manager here at Children's for 40 years, and I used to manage the emergency department. And I had people coming out of the woodwork to apply for our stocking positions. And most of them were folks with college degrees. A lot of them were even nursing students and medical students. And they didn't want that job because they wanted a profession as a stocking technician. They wanted to get their foot in the door, learn as much as they could, and then look for opportunities to move up. And right now, that's what we're seeing. Lots of these entry-level positions in essential roles in some of these restaurant, retail, grocery store elements. And if you can get your foot in the door, chances are you will move up later. So I talked about this. We have approximately 55 to 60 employees with significant disabilities. At the start of COVID, we did send some to work from home, or they were furloughed temporarily, but 16 remained working as essential employees throughout the entire COVID period. That is amazing. We had 16 people with significant disabilities working as essential employees in a hospital throughout COVID. The remaining workers have all been brought back over the last 3 months, and we're now back up to that 55 to 60 number. And so we have a lot of jobs here. We are also looking at other positions that we can hire people into because there's a need. A disability does not rule you out from being an essential worker. A disability does not make you immediately more vulnerable and less important or critical. This is really important. These folks we had with significant disabilities were just as essential, if not more, at Cincinnati Children's than other healthcare workers. I think at one point here at Cincinnati Children's, we had several hundred nurses who were on temporary furlough because their units or their clinics were shut down or the OR was shut down. And yet we still had people with significant disabilities working as essential employees. The cool thing about it is that we worked with them, we looked at the risk, we mitigated the risk, we put in place those co-op plans, we used our COVID curriculums, and we increased the training for the skills that we needed. So I have a couple pictures here from some other sites. This is a picture of a young man who is a project search grad at Cherry Hill, New Jersey, as an essential worker. So he graduated in 2019. He's been working the whole time in patient transport, an essential role. And this is another young man, graduated in 2017. He's an essential employee in the emergency department. He never once stopped working. He was on site supporting doctors and nurses on the front lines of the pandemic the whole time. Now, this picture is a little bit dated. He's not wearing his mask in the picture. He certainly is now, and he's working full time. And this last picture is an essential worker. This is a young man who was hired at the end of last year, right at the beginning of COVID, and he was brought on site at UC Health University of Colorado. And I've included the link here to the video. I'm going to ask Yasmina to see if she can play it. It's fascinating because what you'll hear in this, you'll hear this young man's parents talking about being afraid for him to go to work and whether he should be out working. And then he himself explains why he wanted to continue working and why it was important to him. So I will stop now. I'll let Yasmina see if she can show the video. And then I am happy to answer any questions that you might have. Thanks, Yasmina.
Thank you, Erin. Please put your questions in the chat or question box, and I'm going to try to share the video. Sometimes because we all have different internet speeds, it may not work, but we're going to just try it. Just give me a second.
No, I can't.
Is it working?
It's playing, but I'm not hearing the volume. I think you might have it on mute. Do you? Or the volume?
No.
All right. Well, Yasmina, you called this.
I will just share the link, and everyone can watch. It's less than 2 minutes, so everyone can watch in their own time. Yeah, sometimes it works, sometimes it doesn't. So let me just share the link. Video. Do you want to just describe the video?
I kind of did. It's about a young man who was hired at the beginning of the COVID epidemic, and his parents were worried, and he actually is working in an operating room at a hospital. And it's just a really good short story about him, his experience. You guys are funny, though. I see someone just told me to be quiet. I think so you could hear the video. At least I hope so.
We do have a couple questions coming in. How do we access the at-home job skills lessons referenced here?
Yeah. So, you know, one of the things you can do, you can reach out to me. I know I think the last slide has my information, or the second slide. And you also, if you're, you know, if you're working with a school or a community rehab partner, you might want to look at what lessons you have, but we're happy to assist with that. We also have those COVID-19 lessons. They are not on, oh yes, they are on our Project Search website, if you're on the member portal, for sure.
Are the job coaches on site with the interns?
Do you mean, I'm not following. So in Project Search, the ones that are still continuing and starting this fall, yes, the skills trainers will be on site. With the young people, the people with disabilities who are employed, you know, they are working in competitive integrated employment, so they do not have job coaches. And we oftentimes, if you're a community rehab partner or a school and you're still doing remote learning, then yes, there is an instructor or an educational assistant or a job coach or skills trainer who's available to work with you throughout the day.
Another question from Michelle. Thank you for the fabulous presentation. I want to hear more about how you worked with parents who were reticent about having their child return to work. What strategies work? And at some point, did you just have to go with their comfort level?
Well, it's a really interesting question, Michelle, because it didn't work out quite like I expected it to, oddly enough. And so, you know, we had some. We actually, throughout our programs, talked to lots and lots of people. And this didn't happen a lot, but we had some parents who felt that they themselves were vulnerable because of underlying conditions, and therefore they didn't want their young person going out into the community and working and perhaps bringing COVID back home. And in that case, I have to say what we found out is that the law is actually not on their side. And so the law basically says if you are needed and you are an employee, then you are required to show up. And so I hate even talking about this part because I sound like a meanie capini, but so the reality is some employees were told that they had to come back to work or they would forfeit their job, lose their job. And I think most of them, all of them did. I think the parents just, you know, they didn't understand. They were still looking at it as, I hate even saying this, but we had to talk to our parents about the fact that their folks are doing real jobs. You know, people with disabilities, like I said before, they are crazy capable. They're doing important jobs and important work. They're not just here twiddling their thumbs or because we want a mascot or someone with a disability hanging around. And I think as soon as you explain to the families that they're critical, as critical, if not more critical than any other employee, then I think they get it. If they if they don't see, if they don't fully understand what their young person's contributing to the work site, I think they're more likely to think, well, what's the big deal? Just let them off. I'm at risk. They can come back later. But we really want to get rid of that attitude. Like I said before, it sends totally the wrong message. It and we just don't want to go there. So legally, if you're an employee of a business, whether you're a person with a disability or not, and that person or that business can keep you safe, they have reasonable expectation of keeping you safe, you are required to return to work. The other thing is we just talk to families. We've just been having lots of conversations about risk. I do have to say, though, if I had to give you a percentage, I would say that probably 95% of our families have just been fabulous and reasonable, and understand how valuable their kids with disabilities are in the workforce, and so it hasn't been a huge problem.
How are Project Search and the host businesses handling liability under insurance?
I don't understand the question.
Brian, can you clarify the question? While Brian is clarifying, he has another question. How are Project Search sites under school districts that are not opening face-to-face operating?
Yeah, that one's easy. So our sites that are doing our remote are using our virtual curriculum. So we're using the VoteFit tool to talk to the families, talk to the young people, see what skills they want to grow, want to learn to grow into the job that they want. We're finding ways that we can teach those skills at home using the VoteFit tool. We're including quality and productivity in everything we teach. Another really good example is setting the table. And probably all of you have done this. I feel like I'm preaching to the choir. But it's not as simple as saying, okay, Mary Ellen, set the table, and then allowing Mary Ellen to take her time and do a sloppy job. It's about, as a parent, figuring out how long it takes you to set the table. It's taking a picture of a table that's set properly. And then it's about the person with a disability setting that table over and over again until they do it in the same amount of time that you might, and that they do it properly so that it matches the picture. So it's using a picture, it's using a timer. It's about repeating it over and over again, making folks stand and move around the table. So we're putting a whole bunch of things together to come up with as many virtual lessons as we can, to teach as many skills as we can at home that will apply when we can go back to work. Liability, that's something, I'm just going to take a stab. It's something we always do in Project Search. Any one of our student programs, the school carries liability insurance. So it's no different now. And certainly employees are covered by the hospital and just standard liability, or our employees. But if you're employed anywhere, I would guess, you have some type of liability insurance. I don't think that's a necessary change because of COVID-19.
So Brian is clarifying, most insurance cover insurance under liability, but does it cover COVID?
Well, your health insurance would cover COVID. I don't think any of us have increased liability. You can't prove where you got it. Gosh, that would be really difficult. I have not heard of any single insurer adding a COVID response, but I could be totally wrong. I know here at the hospital, it's our standard health insurance, our standard policies. We have 16,000 employees. We didn't change liability. Um, again, I think it'd be really hard to prove where you got it or who you got it from, or right. And we always follow school policy, so whatever they're doing, we would follow. That's a tricky one. I don't know. I guess that's probably what I should say.
From one of the attendees, from their understanding, the employer either opts in or opts out of COVID-specific liability insurance coverage?
Yeah, like I said, I did not know. I know this is the first time I've heard anything about a specific COVID insurance. I can't even imagine it. But it must exist. That might be another great talk.
Erin, you mentioned policy issues in the UK. Do you see any of that in the US, or is it just mainly attitudinal issues here?
Yeah, I haven't seen any policies. I think our policies, like the two I read, are still pretty on point. And I have to say, I do know, because we work a lot with the UK, they're looking at revising that and getting rid of that vulnerability clause. But I think it's more, from what we're seeing, it's more attitudinal in the United States. But thank goodness I've not seen a policy.
In regards to getting your foot in the door, is that a message getting out to employers, CBOs, or people with disabilities? So meaning, how can we convey that now may be a great time for employing people with disabilities?
I'm not sure, Yasmina. I think it could be happening a lot better than it is. My first call this morning, though, was from a hotel chain called Atrium, and they own 85 hotels across the United States. And they called to see how they could link up with Project Search programs because they've furloughed so many staff that they need some essential workers. They also would love to have some interns. And we're really clear. An intern, if they're doing the whole job, they have to be paid. But if there are things our interns could learn while being in a hotel, we're all in. So I'm not sure how much it's getting out there to businesses, to be honest.
Someone is asking, did you say Atrium?
I did. So Atrium is a, what do you call it? It's like a franchise. And Atrium owns 85 hotels, mostly Hilton properties across the United States. And so I think, it's funny too. The other thing that we see, and this is what I would do if I was looking for employment, I'd go right now to a restaurant, an area that had a lot of restaurants and that are being overwhelmed with regulations. And I'd see if four or five of them could come together to hire a person or two with disabilities and let them move between all of them, especially if they were close by, assisting with sterilizing. Excuse me, of course I've got the hiccups right at the end of my talk. Sterilizing the dishes and the tables and the chairs. But it certainly would be a great opportunity for training people as well.
Where can we find VoteFit tool on the Project Search website?
It is listed on there, I believe. If not, you can go to VoteFit.com. VoteFit.com.
I will put that in the chat box for everyone.
It's a killer tool. And, it was developed by two occupational occupational therapist at Ohio State, and it's one of the best things we've ever seen because it doesn't do things you can do and things you can't do. It says, here's areas where we need to increase training, and if a person can't do it, it's because we need to step in and figure out a different way and create accommodations and adaptations to make it possible.
During COVID, is it best for your young people to be paid for their internship or career exploration experience? So it's
that's a great question.
And then she's clarifying, due to economic hardships and loss of income from family members, do you recommend paid experiences?
I think that right now, if they're doing a job, I think it should be paid or it should have a stipend. And again, that's Department of Labor law. If you're doing a full job and rather than learning a series of tasks, and if here's the other key piece that people forget, and it doesn't mean you're just doing it. It means you're doing it according to quality and productivity standards. So just because I'm in a restaurant and I'm doing one table an hour or a table every half an hour, that doesn't mean that's still to me more like a traineeship, because that certainly does not meet quality and productivity standards. But gosh, if we have a person and they're training, they've been trained, and they're meeting those quality and productivity standards, absolutely. We either need to increase the training and look for training them up, skilling them up in other areas, or we need to make sure they're being compensated for what they're doing. I do think there's a risk during COVID-19 of people with disabilities being taken advantage of and working in full-time jobs if we're not careful.
Thank you, Erin. We're at the hour, so I don't want to keep everyone. I just wanted to let you guys know our last webinar, and it's the new edition, is addressing emotional health needs of people with intellectual and developmental disabilities during a pandemic, a model demonstration project to promote engagement. I'm posting the registration link to that. Thank you again, Erin, and thank you for everyone who have attended the webinar. We are archiving. PowerPoints will be made available, and all the websites that Erin has talked about, we will make sure we have them in one place. We are going to stick around for a few more minutes to see if there are any other questions that are coming through, but feel free to sign off, and you will be receiving an email once the webinar is archived. And again, any last parting words, Erin?
Oh, I would say, first of all, I'm sorry I got the hiccups there at the end, but thanks for letting me do this. I'm honored to be invited, and if anyone wants to chat about it or talk, to me, it's a crazy interesting time, and I'd love to continue the conversation. And I hope you all have a great day and stay safe.
Thank you. We are hopefully we can have updated webinar in a month or two to see what's happening. We're getting a lot of thank yous, and people really thought it was an interesting presentation. We will stick around for a couple of more minutes to see if there are any other questions. Other than that, have a great rest of the day. Michelle, I will put Erin's email in the chat box. Just give me a second to grab it. That way it will be easier to copy paste. Here's Erin's email. It doesn't seem like there's any other questions. Thank you again. This is really different and super interesting of what's happening.
Again, I appreciate it. And thank you for everything you guys are doing to get it set up. Have a great day, Yasmina.
You too. Thank you.
Bye-bye.
Bye.